The most modern cataract treatment is to remove and replace your clouded lens with a transplant clear implant called an intraocular lens, IOL. It normally takes between 15 to 30 minutes and is pain-free. Your eye will be numbed with local anesthesia in the form of an injection or eye drops. You'll stay awake during the surgery, but won't be able to see what your surgeon is doing. Your surgeon will make a small incision of about 2 millimeters between the cornea and sclera. The surgeon may need to make 2 additional incisions to manipulate with surgical tools. Then the surgeon applies an ophthalmic viscosurgical device, OVD, a jelly-like transparent substance to both create and maintain space in the anterior chamber to protect the internal structure of the eye during surgery. Then the surgeon opens the capsular bag where the lens is located and creates a round opening of approximately 5.5 millimeters. They will then insert an ultrasonic probe into the incision to break up your lens and remove the cataract. The pieces will be removed with the probe using suction. A foldable lens implant will be inserted through the incision and positioned where your original lens was located. Usually with this technique, stitches aren't required. You'll rest in a recovery area for about 30 minutes after your surgery and will then go home. Modern IOL, such as trifocal IOLs, provide great comfort for patients and eliminate vision problems for life.